slowly we've been building a workforce so that we can not just sit back and watch this virus unfold, but really get a lot more aggressive and take it to the virus. We don't want to just flatten this curve. We want to stay ahead of the curve. And we are all enduring what was a blunt instrument, a blunt surgical tool of the social distancing we're doing. But in the future, we really see a path where we have a much broader range of tools to fight this war. Now, Dr. Kim said in an article that published recently that you need 5 things to work your way forward. We all know that we're going to need to live with this virus, and we're going to live with it for a while to come, at least 18 months. So what the governor's team, and with the hope of our past governors and others, is we are building an extensive response and recovery plan and network. You have to be able to do the social distancing that we're doing. The things that we're doing and the additional new things we've added continue to be a very powerful weapon in stopping the spread of the virus. But you also have to do testing, and we are pushing the envelope every possible way because you have to test someone to know they have it. And then you have to do contact tracing, which means, again, those disease detectives who talk to you when you're a case and find out everyone you've been in relationship with, anywhere you've gone in the past 14 days. And then those contact tracers reach out to those people and tell them to quarantine for 14 days. And when we have enough testing, test those folks. And in doing that, you can start to snuff out what could be the spread of the virus. And additionally, you need to isolate and quarantine people. And the 5th part is you need excellent treatment. And our treatment is evolving ultimately a vaccine, but it could be an antiviral. It's new things like the plasma that we're doing when we're doing serum, where people with antibodies can be transfused into people who are sick. And so all new tools will come. So it's social distancing, contact tracing, testing, isolation and quarantine, and treatment. And what Jim Young Kim said was, hope is of little use unless it's accompanied by a bold and vigorous plan. And the governor, and what he'll be laying out for you before we get to May 1st, but in the days to come, is more and more parts of that bold and vigorous plan for Ohio. So there are going to be 2 parts to our efforts. One is this army of workforce, because the people we had who usually do contact tracing were public health department-led epidemiologists. But because this is a global pandemic, the scope is so big, you need an army. You need 10 to 15 people per 100,000 population. And that is the army we've been building and are continuing to build. And so being able to see that outbreak, whether it's a prison, a nursing home, a community, a couple of cases that were associated anywhere, and be able to do that work is a way, that's the firefighting side of our house. When we see an outbreak expanding, that we can snuff out the fire. And we're building a command and control structure that sees all the fires in the state and moves on them. And if they don't have enough PPE or they don't have enough testing, we are moving resources so that we can quickly put out the fires of the spread of infectious disease. Ultimately, we knew that 1 person could give this disease to 3 people. But what we want is to ultimately have 1 person giving to 1 person, ultimately 1 person giving to a half a person, and less than a half. And in watching that virus spread and decreasing it, which is what social distancing did, we snuff out the fire of spread and we stop the virus from ever becoming something that takes out our hospitals.